I'm Stephaun Wallace, Director of External Relations with the HIV Vaccine Trials Network, staff scientist in the Vaccine and Infectious Disease Division at Fred Hutch, and a clinical assistant professor at the University of Washington in the Department of Global Health. Hello, I'm Stephaun Wallace, and I'm here to talk about community-informed efforts towards the MOSAICO study. The community efforts towards the development and implementation of the MOSAICO study encompassed quite a few different activities that sought to meaningfully engage communities, not only in the protocol design, but also in the implementation of the study itself. In March 1 of 2019 in Seattle, there was a community review of the protocol and informed consent form that was face-to-face, and it included 11 members of our US community teams, as well as Latin American representatives. These persons were site communicators, educators, and CAB members. And part of what came out of this meeting was deciding on the specific language for the informed consent form, as well as ensuring that the language that was used in the informed consent form was also harmonized with the protocol itself. In April 19 of 2019, in Atlanta, Georgia, in the US, there was also a community and ethical review of the study. The attendees included 42 persons representing community and ethicists, site investigators, and academic partners. Part of the meeting included an overview and background of the study, the formative research that led to the development of the MOSAICO study, as well as what the plans were regarding community engagement for the study. Some of the outcomes from this consultative process included a positive feedback on the study design and the considerations associated by the attendees. There was a specific underscoring of the need to educate communities about biomedical HIV prevention research and technologies generally, including a specific call out to talk about the clinical trial design and history, not just used in this study, but in general. There was also a specific note that intended use language regarding PrEP interest was not recommended, and instead, it was recommended that PrEP be offered to everyone, and those who do not wish to accept it be enrolled in the study. Site PrEP and prevention plans were discussed as well, including the need for them to have very clear language and include local considerations, and even more specifically and importantly, that they should be informed by local community stakeholders. April 25 through 26, 2019 in Philadelphia, there was a protocol team review that included 20 protocol team members, many of which also included not just US, but also Latin American community representatives. It was in this meeting that we further aligned the protocol and the informed consent form, as well as finalized the informed consent form. In an ongoing manner, the clinical trial sites investigators continue to engage their local communities, providing overviews of the study, also discussing and inquiring with local communities about the acceptability of the study in the local context, and sought to build community support for the implementation of the MOSAICO study. In addition to the specific activities associated with the design and implementation of the study through the protocol and informed consent review, we also engage community partners and advocates in the process in order to get their perspectives and their feedback as well. In 2019, we had conversations with Black AIDS Institute and the Treatment Action Group on conducting collaborative stakeholder engagement activities that would center the MOSAICO study. As part of these activities, the group implemented a survey that was used to collect and hear about perspectives on the safest, most ethical, and effective ways to study new HIV preventions in these clinical trials in communities. During this process, there was also conversation with communities about the potential for other strategies to engage communities around new clinical trial intervention types. These specifically included HIV vaccines, antibodies, and immune-based approaches, as well as new forms of PrEP. Many of these organizations have participated in different other community-based sessions and conversations. So this was truly a comprehensive and engaging process across multiple stakeholder groups. The organizations, Black AIDS Institute and the Treatment Action Group, have participated in monthly planning and evaluation calls and continue to do so to engage community advocates in the US, noting specifically social media channels, other network channels to share information about HIV education, prevention, as well as treatment. Black AIDS Institute and the Treatment Action Group partnership has continued and will continue and has included a dissemination of survey findings. And the continuation of this collaboration has also included training community members on biomedical HIV prevention information, as well as other stakeholder engagement approaches. In July 22nd of 2019 in Mexico City, Mexico, there was a consultation held there as well that was titled HIV Vaccines R&D, A Vision for 2020 and Beyond. And it was sponsored by the IS Global HIV Vaccine Enterprise in collaboration with AVAC and the HVTN. There were quite a few advocates there, clinical trial researchers, regulators, funders from various countries involved in HIV research. And the purpose of this consultation was to, again, identify stakeholder perspectives on the current state of where we are with HIV vaccine research and development, and to also discuss what is the need for continued development and innovation in the strategies of vaccine research and development, and how all of this fits into the larger context of HIV prevention. To identify these next steps and priorities for incorporating stakeholder perspectives into the research and prevention agenda by decision makers was also discussed and underscored that it's important that we continue to do the work to engage communities meaningfully in the process. In May 9, 2019, there was also an interactive webinar that was held in collaboration with the Black AIDS Institute and Treatment Action Group and the HVTN. And during this webinar, this was another example of the work to engage communities. We discussed the history of research with respect to biomedical interventions in Black communities in particular, understanding the disproportionate burden that HIV has in Black communities, particularly in the US. During this webinar, we also discussed many of the current conversations and the understanding around how clinical trials are designed in order to evaluate interventions with a particular focus on vaccines. We also discussed during this webinar the importance of community input in vaccine trials and some of the best practices for communities to become more involved with trials and research as advocates, as participants, and also as general community members. In May 30, 2019, in Charleston, South Carolina, we collaborated with an organization to host the Saving Ourselves Symposium pre-conference, which drew lots of different members and groups from around the country with a particular focus on people of color, particularly those who identify as LGBTQ. During this pre-conference, we convened 30 plus persons who are involved in community education and outreach efforts to conduct a training to increase the capacity of these attendees to understand the HIV prevention science landscape and to be able to be more actively involved in conversations and building decision-making capacity regarding participation in HIV prevention programs and/or research. Certificates were provided to persons who completed this training. And one of the key things that was important to take away from this training was the discussions in which the attendees were able to debunk myths and really engage in thoughtful conversations around how accurate information is important and how the messenger of this accurate information in key communities is equally important. I want to thank the protocol team on the HVTN side. Many of the names mentioned here you might be familiar with, as well as our Janssen colleagues for supporting this effort and working in tandem to implement and design and really engage this study, as well as our funders and other collaborators for their support. Thank you.